I'm going to be performing a pretty comprehensive medical assessment on you today. This is going to involve looking at your chest, looking at your neck, your face, ears, eyes, nose, mouth, throat, upper and lower extremities, the whole gambit. Is that all right with you? Wonderful. Let's get started with your chest. So I'm going to do a little bit of palpation to start. I am going to be feeling for what are called heaves and thrills. I'm going to use the heel of my hand to feel around your chest for heaves. Then I'm going to be using the flats of my fingers to feel for thrills, which are a palpable heart murmur. So I'm going to put my hand on your chest here. And we're going to start with the heaves. Have you had any sort of shortness of breath, chest pain, changes in your heartbeat, unusual fatigue, anything like that? I see. Hey, let's do the thrills. Good. And any history of cardiovascular issues in your history or your family medical history? Okay, let's go ahead and take a little listen. We are going to auscultate the heart to start. A little bit of a rhyme there. We'll start with the aortic valve here at the top. Just breathe normally here. And over to the pulmonary valve. Okay. Down to the tricuspid here. Good. And over to the mitral valve. Good. Let me just right here. Good. Okay. Everybody seems to be opening and closing just fine. So now I'd like to listen to your lungs. Have you had any breathing problems, any wheezing, or does it feel like you can't catch your breath at all? I guess that goes in with shortness of breath, doesn't it? Does it feel like you are panting at all, anything like that? Okay, all right. So let's start here, the apex. So I'm going to have you take a deep breath in and out. There we go, nice and slow. Deep breath in and out. Nice big inhale and an exhale. Okay, so far no crackling, no wheezing, no stridor. So take another deep breath and out. Go way down here. Deep breath in. Good. Last row here. Deep breath in and out. Okay. Deep breath in and out. There we go. Good, good, good. All right. While I have the stethoscope in, I've love to do some auscultation on the abdomen. So we're going to listen to our digestive sounds. We're also going to look for the aorta and listen to the renal arteries as well. So go ahead and just breathe normally again. And I'm going to take a little listen around. Good. Any GI issues at all? Okay. All right, so aortic area right there. Good. Just keep breathing normally. All right, let's get those renal artery sounds. Then we'll do some palpation here. Okay, the other side, do that bilaterally. Okay. Just set that down. And now, since we're going to be doing some palpation, I am going to be using 2 different pressures. One of them will be pretty normal. It's a firm pressure, but not too uncomfortable. The other one is going to be a deep pressure, and that will be a little uncomfortable. But what I've found is it helps quite a bit if I guide your breathing a little bit through that. So we'll do that, distract you a bit. So let's go ahead and feel around in here. Let me know if there's any pain or tenderness. Very important. We'll start with just feeling with the one hand. And I'm also going to have to pay some special attention to a few organs as well. Okay. Let me go ahead and palpate our aorta here. Good. Do you ever look down at your abdomen and see the bit of bounce with your heartbeat? I always found that quite fascinating, but I was a bit of a strange child, so I might not be joined in that. Now, renal arteries here, so bilateral. Go ahead and just keep breathing normally here. There we go. So let's get into our deep pressure. I'm going to use 2 hands together, and we are also going to feel around, for example, the liver. We're going to feel for the spleen, the kidneys, see if there's any enlargement there. And I'm going to have you take a deep breath in and out. Okay, deep breath in and out. Let's do one more deep breath in and out. Okay, you have survived. Let me just jot down, let's see, so we did. Let's go ahead and bring our stethoscope back into play. And we're going to come up here and focus in on the neck. So here we're going to start by auscultating the carotid arteries. So you can often feel these right in here. Mine's pretty strong right here and on the other side. So I'm going to take a listen here. And I'm going to have you take a breath in and hold so that I'm not hearing the air travel through your windpipe at the same time. So take a deep breath in, hold, and exhale. Good. Other side here. Deep breath in and hold and exhale. There we go. So we were listening for any bruits or audible heart murmurs. If that was present, then I wouldn't want to put my fingers and press them into this area. So we don't have any of that. I'm going to just press right here for a few moments. You can breathe normally. Okay, good strength there. Good. Other side. Right there. Good. Good. Now we're going to do a special test here in which I'm going to have you turn your head to the left. And we are going to look at your jugular venous pressure in the neck. And we're also going to check your hepatojugular reflux. So when I pressed in right here, right on the liver, is this painful at all? Okay, good. So I'll start by having you just turn your head and we'll look at the neck, look at the venous pressure here. All right, so I'm just going to get a little light here. I can see it a bit better. You're not going to see the light. Just helps illuminate the spot so I can see any movement. There we go. There we are. Okay. All right. Now you're going to stay right there. I'm going to press in on your liver. I'm going to do this for about 10 seconds, and I'm just going to look at that reflux. So there's going to be a change in the pressure for just a little bit, then it'll go back down. So right here, you ready? Okay, and press in. 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 7 Mississippi, 8 Mississippi. Good. Okay, reflex looks good. Now I'm going to be looking at your trachea. Make sure this is midline, for example. So I'm just going to feel right here. This can be a pretty vulnerable area, so I'll be very gentle here. Just want to assess the alignment. And then also while I'm here, let's feel around the thyroid area. And I want to just measure the cricosternal distance here. So in the throat here, in this area, we have our hyoid bone, we have our thyroid cartilage, and then we have the cricoid cartilage. So I'm going to be measuring the distance from the cricoid cartilage to the sternum, to this little manubrium bone right here. And on most people, normally, this is 3 to 4 fingers. There we go. Yes, and that's right in there. Okay, excellent. Feel good. Excellent. Now let's check your lymph nodes here. Start at the back of the head. Good, and move to behind the ears, in front of the ears, underneath the jaw, and along the neck here. Good. Last little bit here, I'm going to just bilaterally palpate the temporal arteries. Right in here. Good, and then we're going to have to grab a little tool here because we are going to get into looking at the ears, and we'll be assessing some cranial nerves as well. There we go. So I'd just like to take a look inside the ear, pull it up and back to straighten the ear canal, and then I'll just take a peek, see if there's anything going on in there. We'll start right here. I'm just going to be pulling up and back. Working with the otoscope in the ear. There we go. Okay. Any pain or discomfort at all? Alright, good. So I'm just going to bring my arm down. There we go. Can't keep it there forever. And we'll just peek around. Had any issues with your hearing at all? And any pain with the ears? Any odd feelings, itchiness, fullness? Okay. So our ear canal looks good. Tympanic membrane is intact. Correct color. We have our cone of light, and tip of the malleus, or landmarks, are visible here. Okay, so that looks good. Alright, we'll take a peek on the other side. Just go up and back here. There we are. How about this ear? How are we doing in terms of any discomfort? Okay. We're just going to look around a bit. Look around a bit so I'm not seeing signs of infection, no impaction, and no perforation. All looking good. So there's our landmarks. Good color on the membrane. Canal's clear. Be pulling this out. And then turning off the otoscope there. That looks all good. Now I'm just going to very quickly test your hearing for our vestibulocochlear nerve, one of our cranial nerves. So if you could just tell me what word I am whispering. 8, 16, Other side. 45, 96, 31, 62, 73, 2, 11, 98, 68, 35, 40, 57, and 12. Okay, excellent. So cranial nerve 8 is intact. Now, I'm going to ask you to perform a series of facial expressions to test cranial nerve number 7. So if I could have you raise your eyebrows. Good. And can you close your eyes real tight? Open them real wide. Okay, puff out your cheeks. Excellent. Can you smile real big? Okay, and can you frown? Yes, it feels kind of goofy trying to do all that, but looks like that all is good. I didn't see any sort of palsy or abnormality in the movement. Let's take a peek in your mouth, and we'll look at a few other cranial nerves. I could have you just open your mouth real quick. There we go. I'm just going to look at the teeth. Good. And the tongue we'll get a better peek at in a second. Oral mucosa looks good. You could just stick your tongue out as far as you can. Good. There. Now if you could say ah for me. There we go. Good. And the pharyngeal wall looks good. No cobblestoning. No color there. Okay, good. And you can put your tongue back in your mouth for just a second. If I could have you take a dry swallow for me. Just like that. Good, okay. So, glossopharyngeal. Vagus nerves look good. If you could stick out your tongue and then move it to one side, the other, up, down. Okay, hypoglossal nerve is intact, and you can put your tongue back in your mouth. So cranial nerves 9, 10, 12. Good. Right. Can I have you look here at my finger? Okay. Can you look at the flowers? Back at my finger. And then look at the lampshade. Back at my finger. Okay, accommodation reflex is intact there, so I'm going to have you just watch this light using only your eyes without moving your head. Just track the light with your eyes. Up, down. We're looking at the oculomotor, trochlear, and abducens cranial nerves 3, 4, and 6 here. These are your eye movement muscles for the most part. Just keep following the light here. And it's very important to test your cardinal directions of gaze. Make sure your eyes can move in all directions. We're going to come in and out. going to be doing some sensation testing, and we're going to do it not just on the face for the fifth cranial nerve, but also on your extremities as well. I am going to lightly touch your face in the three branches of the trigeminal nerve, the ophthalmic, the maxillary, and mandibular. We're going to make sure this all feels the same and that you can feel the touch bilaterally. And then we'll do light touch on the arms as well as the Wartenberg wheel, just to test our, it's called pain sensation, but I'll show you. It's more like being able to sense the ability to feel something sharp, so you can see this doesn't break the skin. I can tell it's sharp, but it doesn't hurt. Just like that. So, for the face, if I could just have you close your eyes and tell me if you feel a touch. Good. Mm-hmm. Good. Yep. Mm-hmm. Good. Mm-hmm. Yes. Mm-hmm. Good. Mm-hmm. Okay. Mm-hmm. Okay. Mm-hmm. Yes. Yes. Okay, very good. So, did that feel the same on both sides? So, for example, this versus this? It did. Okay. Well, you can keep your eyes open for the light touch test on your extremities. So, I'm just going to ask if you can feel this. Mm-hmm. Here. Good. Okay. Good. There. Okay. All right, and on the legs. Okay. Okay, and on the feet. That was all able to be felt. Okay, and did that feel the same on both sides, or was there any difference? Okay, let's try that with the wheel here. So I'm just going to be rolling this along your arm or your leg. You just tell me that you feel it. Okay, you feel that. That? Good. Mm-hmm. Other side. Good. Okay. Good. Legs. All right. Other side. Okay. Okay, good. And did that feel the same on both sides as well? It did. Excellent. So let's just jot that down. So definitely trigeminal nerve is intact. And palpation. For cranial nerve 11, I'm going to have you do a couple of shrugs of your shoulders here. This is the accessory nerve. Very easy to test. Okay, I'm going to try to push your shoulders down. I want you to press up against me. I'm going to push down, you press up. There we go. Now would you mind if I look at your hands and your arms? Good. So I'm going to be looking for any signs of clubbing here. So if you could just put your fingers together, there should be that little window between the two. And we're looking for that window. Good. And then we'll look at the nails and at the joints. Any pain or heat in the joints at all? Any soreness? No? Okay. And let's just look at the nails and press on them. Look at the capillary refill. Okay. And the hands are warm and dry to the touch. I'm going to just check the temperature on the rest of your arm. Okay. Let's look at the skin. You could just show me your elbows. I see this area right in here. And that's clear. Okay. So no plaques or anything like that right there. Okay, so I'm going to have you squeeze my fingers as hard as you can here. Good. And can you do that with just your thumb and forefinger? Do a little pincer grip here. Okay. Good. Can you put your arms up like this, right in front of you? I'm going to try to push you forward. I want you to resist me. So hold strong here. And I'm going to try to pull you towards me. Hold strong against me. Very good. Now let's check some of your reflexes while we're up here. Now, I'm going to have you put your forearm over your thigh so that your hand hangs down between your knees. And then I'm going to elicit the triceps and biceps reflexes here. So go ahead and just let your arm relax. Let the arm relax. And I'm just going to do a few taps here. Excellent. Good. I'm going to hold this arm. I'm just going to cup it and then tap in the crook of your elbow. There we go. Get a little bit of muscle jumping. Now if you could just switch arms. Put the other one on your thigh with the hand dangling. And just let the hand dangle. Let the arm relax. Let your leg take the weight of your arm. There we go. Good. And I'll cup your arm for the biceps reflex. Good. Now the lower extremities here. let's take a peek. So skin looks good. Temperature feels good. Okay. And let's go ahead and check the popliteal pulse at the back of the knee. Okay, it's a tricky one, but we got it in one. Over here. And then we've got dorsalis pedis. And the post-tib pulses, we'll start with post-tib. And then dorsalis pedis, just palpating bilaterally here. Good. Let me look at your feet. Use some capillary refill testing here. And any swelling, pain in the feet at all? No. Okay, good. Very good. So, let's go ahead and grab our reflex hammer, and then we'll do a couple of strength tests. So, I'm going to have you put your foot on my knee here. There we go. I'm going to hold your foot and then get our Achilles tendon reflex. Okay. Other foot up here. There we go. Alright. And if you could let your legs dangle so I can get the patellar reflex. Okay. Nope, nope. There we go. Other side. Good. Got a lot of little jumps there. Okay, so I'm going to put my hands on top of your legs here. I want you to push up against me. And there we go. I am going to try to pull your lower legs towards me. I want you to resist. Good. I'm going to try to push your lower legs towards you. I want you to resist. Okay. I'm going to try to push your foot down. I want you to press up against me. And I'm going to try to bring your foot up. I want you to press down against me. I'm just going to come underneath here and press up. Good. So, last thing, I forgot to get our upper extremity pulses. We're going to start with radial, then ulnar, and then brachial. Radial first. And not so much measuring the pulse rate as feeling the quality and the strength. Okay, ulnar. Other side, radial and ulnar. Ulnar is always just a bit more tricky. There we go. And then brachial. Good. That was a good one. Got it in one. There. Sometimes you have to do just a little bit of feeling around. Yeah, this one's a little trickier. There we go. There we go. Nope, that's good. That's good right there. So, do you have any questions for me at all? Okay. Well, I did not find anything abnormal. You are coming away with a clean bill of health. So I am just going to sign right here. There we are. And that will conclude the assessment. I would like to thank you so much for coming into my office to receive this examination. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.